Stop believing that heart aging is something that only happens in your 70s, because what I'm about to tell you goes against what most people assume about normal aging. The truth is, your heart can age 10 to 15 years faster than your actual age, and in many adults over 40, it already is. And here is the part most people never hear. A major long-term study from the Framingham Heart Study, which has tracked cardiovascular health for over 70 years, found that more than 60% of adults over 45 already show measurable signs of accelerated arterial stiffening, even if they feel completely healthy. Another large analysis published in the Lancet showed that early vascular aging increases the risk of heart attack and stroke by nearly 2.5 times, even in people without obvious symptoms. Now listen carefully, because if you stay with me until the end, I will show you the single most powerful habit that can literally reverse part of this fast heart aging process in just a few weeks, and most people completely overlook it. Before we dive in, I want to ask you something important. How old are you, and have you ever had your blood pressure or cholesterol checked in the last year? Be honest in the comments, because I read every single one, and your answer might help someone else realize their risk early. Let's begin. Number 5 is your blood vessels slowly becoming stiff without you feeling a single symptom. This is one of the most dangerous silent changes in the body, because you do not feel it happening. A study from Johns Hopkins University found that arterial stiffness increases by nearly 30% in adults over 40 who have poor lifestyle habits, even before hypertension develops. That stiffness means your arteries lose their natural flexibility, making it harder for blood to flow smoothly. Think of your arteries like brand new rubber pipes. When you are young, they expand and contract easily with every heartbeat. But as you age, inflammation, sugar exposure, and oxidative stress cause those pipes to harden like old plastic tubing. That makes your heart work harder every single minute of every day. One of my patients, James, a 58-year-old accountant from Chicago, came to me for fatigue. He had no chest pain, no warning signs. But testing showed significant arterial stiffness that had been developing silently for years. After improving his diet and adding daily walking, his vascular flexibility improved within months. For aging hearts, this matters even more because after 50, collagen builds up in artery walls by nearly 40%, reducing elasticity. To help reverse this, timing matters. A 20 to 30-minute brisk walk after meals helps improve endothelial function, which is the inner lining of blood vessels. A synergy tip here is combining walking with deep breathing. Oxygen-rich blood flow helps relax vessel walls and improve circulation efficiency. Number 4 is something most people ignore because it feels normal: rising blood pressure that slowly damages your heart. Hypertension is often called the silent killer for a reason. A large WHO report shows that nearly 1.3 billion people worldwide have hypertension, and more than 46% are unaware of it. In adults over 50, blood pressure increases due to narrowing arteries and reduced nitric oxide production. Nitric oxide is a molecule that keeps blood vessels relaxed. After 40, the body produces nearly 50% less of it, which leads to tighter, higher-pressure vessels. Imagine your heart as a pump pushing water through narrowing pipes. The pump must work harder every year, eventually leading to strain and thickening of the heart muscle. One patient, Maria, a 65-year-old retired teacher from Toronto, had blood pressure readings she thought were normal for her age. But in reality, they were silently damaging her heart. After lifestyle changes, her readings improved significantly within 2 months. For older adults, sodium sensitivity increases, meaning salt has a stronger effect on blood pressure than it did in youth. A practical tip is reducing processed foods and increasing potassium-rich foods like bananas and spinach. A synergy tip is pairing potassium intake with hydration, which helps regulate fluid balance and reduces vascular strain. Now, before we continue, if you are finding this valuable, take a moment to like this video and subscribe. I share science-backed strategies every week to help you protect your heart, brain, and independence as you age. Let's move forward. Number 3 is reduced heart pumping efficiency that often goes unnoticed until it becomes serious. This is where things become more serious but still reversible. Research from the American Heart Association shows that cardiac output can decline by up to 1% per year after age 40 if physical activity is low. That means your heart gradually pumps less efficiently over time. Think of your heart like an engine. A well-maintained engine runs smoothly for decades. But if it is not used properly, it becomes sluggish, less responsive, and less powerful. One of my patients, Robert, a 70-year-old former postal worker from New York, noticed he was getting tired just climbing stairs. He assumed it was age, but testing showed reduced cardiac efficiency. After a structured walking program, his endurance improved dramatically. Aging plays a major role here because mitochondrial energy production in heart muscle cells declines by nearly 35% after 60, reducing contractile strength. To improve this, timing is key. Short bouts of movement throughout the day are more effective than one long session. A synergy tip is combining aerobic movement with protein intake, which supports muscle maintenance, including heart muscle support systems. And now we pause briefly. If you are still watching, it means this information matters to you. Consider subscribing so you do not miss future videos that can help you stay strong, active, and independent for years to come. Let's continue. Number 2 is silent inflammation that slowly damages your arteries from the inside. This is one of the most underestimated causes of heart aging. A study from Harvard Medical School found that chronic low-grade inflammation increases cardiovascular risk by up to 70%, even in people with normal cholesterol levels. Inflammation acts like rust forming inside your arteries, gradually damaging the smooth inner lining. As we age, a process called inflammaging increases baseline inflammation by nearly 25 to 30%, making arteries more vulnerable to damage. One patient, Linda, a 68-year-old from Boston, had no obvious heart disease symptoms but showed high inflammatory markers in blood tests. After dietary changes and stress reduction, her levels dropped significantly within 3 months. To reduce inflammation, omega-3 fatty acids, turmeric, and antioxidant-rich foods play a major role. A synergy tip is combining omega-3 intake with vitamin D, which enhances immune regulation and reduces inflammatory response. Now we reach the most important factor of all. Number 1 is metabolic dysfunction that accelerates heart aging faster than any other factor. This is the core driver behind everything else. A major study published in Cell Metabolism found that insulin resistance increases the risk of cardiovascular disease by up to 2.8 times, even in individuals without diabetes. Think of insulin as a delivery system for energy. When it stops working efficiently, fuel builds up in the bloodstream instead of entering cells, creating damage everywhere, especially in blood vessels. One of my most memorable patients, Alan, a 72-year-old from Seattle, reversed early metabolic dysfunction through consistent walking and dietary adjustments. Within months, his blood pressure improved and his energy levels increased significantly. After 50, insulin sensitivity can decline by up to 50% if lifestyle habits are not controlled. To improve this, one of the most powerful tools is post-meal walking. Just 10 to 15 minutes after eating helps muscles absorb glucose directly from the bloodstream. A synergy tip is combining walking with resistance training, which increases muscle mass and improves metabolic health long-term. Now step back and look at the full picture. Your heart is not aging randomly. It is responding to lifestyle, inflammation, and metabolic pressure. The good news is that in many cases, this process is not only preventable but partially reversible. When you improve circulation, reduce inflammation, stabilize metabolism, and support your blood vessels, your heart begins to function in a more youthful way, even after 40, even after 60. I have seen patients in their 50s, 60s, and 70s regain energy, reduce medications, and improve quality of life simply by making consistent changes. Because the goal is not just a longer life, but a stronger, more independent one. The ability to walk without fatigue, to climb stairs without fear, to enjoy time with family without constant worry about your health. That is what protecting your heart really means. And it is never too late for your body to respond when you start taking care of it. If this message resonated with you, make sure you subscribe so you do not miss future evidence-based health insights. And now I want to ask you something important. After hearing this, what is the first change you think you could make this week to protect your heart? Tell me in the comments. I read everyone, and your experience might inspire someone else to take action today.